Now you are joining with us with the publication workshop on the title, The Ins and Outs of Publishing in the Academic Journals. Today at ICOPH 2021, we are very privileged and honored to have the presence of Dr. Thanakorn Jirasevijinda. Dr. Thanakorn is also known as Dr. TJ, is an associate professor of pediatrics at Weill Cornell College of Medicine in New York City. He currently serves as the Director of Pediatric Undergraduate Medical Education. Dr. TJ was recently named as a recipient of the Fulbright US Faculty Scholar Award in Medical Education for the 2020 and 2021 academic year. Prior to joining with Weill Cornell, Dr. TJ held academic positions at the Albert Einstein College of Medicine, where he was inducted into the Leo M. Davidoff Society for Teaching. He served as attending physician at Bronx Lebanon Hospital Center, where he was also Associate Residency Program Director and Pediatric Clerkship State Site Director for ACOM students. During the time, Dr. TJ served as a co-investigator of HRSA grant for the residency training in cultural competence from 2005 to 2008. Dr. TJ is the editor-emeritus and the Patient Voices at the Journal of Communication in Healthcare, Strategies, Media and Engagement in Global Health, and Associate Editor at Health Equality. He has conducted workshops and presented abstracts on medical education, cultural competence, health literacy, and scholarship and publication regional, national, and international conferences. Ladies and gentlemen, it is my pleasure and honor to invite Dr. Thanakorn to officially start the day 2 with the publication workshop.
Hello, good morning, afternoon, evening to everybody. I really appreciate everyone being here. I'm excited to share a lot of my experience and hopefully expertise with you in this area. And thank you so much for the kind introduction. And I really am excited to be here. I wanted to share my screen, here are my slides, but I will go ahead and do that. My talk, as was mentioned, is about the ins and outs of publishing in academic journals. I will be going over some important aspect of this, and hopefully we can get a very interactive session going, okay? I have a few interactive platforms that I would like for you guys to start the conversation. And I also want to make sure that you understand the purpose of my being here is to make sure that you guys succeed. It would make me really happy that more and more rigorous, very high quality articles get published. And so I want to make sure that I succeed in walking you through some of these steps. So as was in the introduction, I'm currently the editor emeritus of the Journal of Communication in Healthcare. I continue to serve as a section editor for Patient Voices at the journal, and also the editorial board member and peer reviewer for many other academic journals. I want to also make it clear, though, that I'm here to speak with you as an editor in general, right? I'm not specifically representing the journal. I want to make sure that my talk is very balanced in that I want you to understand the ins and outs of submitting to any journal, okay? And then this presentation will focus on publishing in academic journals in English. I will not be covering book chapters and other things that are not peer reviewed. So first off, I would like to acknowledge that the materials that I'm presenting to you, I have adapted some part of it from a workshop that I conducted previously with these authors that you see, my colleagues from across the US, and I want to give them acknowledgement. And then I have to show you this obligatory Zoom Netiquette slide. And again, I want to make sure that there are many participants in the room. If you can turn on your video, fantastic. You please mute your microphone so that we can everybody get a chance to take turn to speak when the time comes. And then, you know, at some point we will be able to unmute and ask questions, etc. Please stay engaged and raise your hands or, you know, put things in the chat. And I would also ask if someone in the organizing committee could see if there's any chat coming from any participants in the chat box. Please go ahead and mute and let me know, because when I'm in presentation mode, I don't necessarily see it. So if anyone can help me, that would be so awesome. Okay.
So Dr. Rija, I'm here.
Yes, great. Thank you so much. Thank you so much. So then, you know, I also want to say that with engagement, there's a couple of Zoom functionalities I'll be using. And then I'm using something called Padlet, and we'll go over that a little bit. I want to make sure that we have a collaborative learning going on. And then here is my email if you want to take a screenshot and or jot down the information. You know, we can, I'm available for you guys to email even afterwards. Okay. So then if you can, if you want to, you know, name yourself or rename yourself and then add your country, it's fine too, that's optional. And then here are, obviously you guys know about these Zoom functions already, and we'll be using chat a little bit, as I mentioned. There's some raised hands that, you know, you would be called on by the organizer as well, okay? Now moving on, would you, I'm sorry, can you give me 1 second? I forgot to do one thing that I think is really important. I had done this before, but I wanted to see this. So as you guys are in the comfort of where you are, I'm putting in a few links. Can you guys see the links that I put in the chat box?
Yes, we can.
I will refer to these links periodically, or as the session goes. The first link I would like you guys to go to is the first one that says Poll Everywhere, okay? So please go ahead and go to Poll Everywhere. And I would like to actually start this poll. Okay, so with Poll Everywhere, it will take you to, I need to activate it. There you go. If you can go to Poll Everywhere, that first link, and you can put on a pin drop. There you go. Somebody put in, I guess that is Indonesia or Borneo, if I'm not mistaken by my geography. There's many from Asia. Awesome. There's many other participants from Asia as well. That's great. This is one way for me to sort of keep track of who's from where. But at the same time, I want to let you know that once this happens, I can see that people are also able to access Poll Everywhere, which is an important thing that I want to make sure everybody has access to. Okay, great. So then with the next thing, this is a multiple choice question. Would you answer this question about yourself? My level of experience with publication is level of an expert if you're an editorial board member or mentoring others. You are proficient, meaning you've written manuscripts before and it's a fun part of your job. You have done peer review. You're competent, or I have a good process of writing a manuscript, or you're advanced beginner, or you're novice and you're planning stage. You're kind of trying to, you get stuck somewhere, but you're trying to move forward. Okay, I'm gonna wait for another couple of 20 seconds also to see if anybody else. Fantastic. I can see that there is a mixture of different levels. I'm glad really as well that there are many proficient authors in the room and peer reviewers, because then if there are any questions or anything like that, I might refer to other people's expertise, etc. Okay, so keep the polls coming. That's really great to see that there is a mix of different groups as well. Fantastic. Okay, good to see this, and thank you for responding. The next question I have for you guys is, okay, so I think I've given enough time to do the, okay, there you go. I've given enough time for the for you guys to respond. So we're gonna keep going. Okay. The following best fits or fit my role or roles at my institution. You may select more than one answer. If you can let the group know, are you a teacher? Are you a researcher? Are you still in training, or a student or a trainee, resident, fellow, etc., administrator, and or others? And for others, you can put your information in chat box, if you will. So again, we have a mix, and I think that a large number of you guys are actually students or trainees or learners. That's really great. And I hope that you guys are, just starting this process, and hopefully will continue to be successful. Great, fantastic. It's really great to see the mix. Okay, awesome. The next thing is, no, hang on a second. We've done that part before. Okay, sounds good. Fantastic. Thank you for responding there. Now, the second piece I would like for you guys to do is participate in what we call Padlet. Okay. If you have a smartphone, please go ahead and use a smartphone and use your camera function to basically read the QR code. That will take you to a different platform where you can put in responses in response to the questions I will pose. You can also use the second link I have in the chat. When you click on it, it should be a Padlet. And in Padlet, you can enter some things. If you can please test your access by entering your first name and country. You can do that by using the plus sign at the bottom of a column to enter your response. And the answers are pretty anonymous right now, okay? So awesome. Thank you so much. Somebody added that Padlet thing. You can also go to the QR code if you like, okay? And what I would like to show you guys is right now is this, right? So as you can see, it's really easily capture a lot of different people, right? From Indonesia. And I think this sort of, corresponds to the map as well. If you haven't had a chance to keep doing it, please go ahead. Okay. Yeah, I see many people are active. So please go ahead and enter your name if you'd like, or just the country if you'd like. So this is great. Awesome. I also see that many of you guys have looked at into this, right? Which is not about barriers in general. The question is, I would like to hear from you guys what your particular barriers to submit manuscripts is, okay, or are. You can enter more than one. And what I would like to do is hopefully, we would be able to address a lot of these. Writing, meet the journal criteria. Okay, great. Thank you for that. Have a nice day wishes. Too many tasks. Fantastic. I'm going to talk to you guys a little bit about the ins and outs and the process. And hopefully at the end, with so many tasks, right, you can see what it is that, we can do it in a very systematic way. Okay. Time is a huge factor, and we'll discuss that a little bit. Too much to do, absolutely. And I'm interpreting that as too much as in you have your regular job and then you have to write, and how do you even do that? Okay, how do you squeeze time into it? Beginning of the process, a little bit new, great. Hopefully you'll learn a lot of things. What's enough to be included? Fantastic. So we'll know, we'll learn more a little bit. Writing is boring. It is maybe true, but I would say that writing about something you care about, writing about something that can advance your career and or disseminate or share knowledge may be exciting. The writing part may be, but really the purpose at the end, hopefully that's exciting. Journals take too long to respond, almost a year, no responsive. Well, we're going to talk about that as well, because certain journals take a long time. Certain journals promise certain things, and certain journals, etc. So I want to show you guys where to look for some of these journals. Finding the right journals, that's a big topic we'll discuss. Writing effectively, we'll discuss that as well, okay? So you guys have already progressed down to the next one. What do editors look for in a manuscript, right? So the aim and scope, absolutely. Fit for the journal, good grammar, absolutely. The writing has to be good quality. This one, I really appreciate what you said about quality. I want to let you guys know though, quality means many things to many people, right? So it would be important to know, to understand, to realize what quality manuscript means. When you understand that, then you can sort of move towards and really reach that quality. Scope and method, important. Content, absolutely. Methodology. Methodology come up a couple of times, and I say methodology is really, really, really an important thing. I'm going to see if anybody else has anything else. So journal of qualitative is hard to find. It's true that it's hard to find. Oh, I meant journal qualitative or journal quality. Again, I'm going to show you guys how to really look for those journals. Analyzing collected data comprehensively. In many ways, you know, you can partner with a statistician, a librarian, or whoever else. And we're going to touch on that a little bit. Okay. The novelty, absolutely. Okay, fantastic. Keep those coming if you want to, because we want to come back to this board. But at this point, I'm going to move forward a little bit. Okay. So I want to show you guys the barriers, and I want to show you that you're not alone. Okay. I have some citations here. And basically, you know, there was a study, Mayo Clinic report, based on a survey of attendees at conferences. They mentioned that, you know, common barriers include organization, which is you guys talked about. Writing could be boring or could be tedious, takes up a lot of time. Following journal format, defining the article scope, disliking writing, responding to reviewers if you got to that point, and also data presentation, right? Exactly what you guys said. The second thing is, sorry about this. The second thing is in the nursing literature from 2015, it, you know, they cite the lack of understanding of how to write for publication. Sometimes the writer's block when you don't really know what else to put on paper or on a computer. Limited time and fear of rejection. Fear of rejection is real. And I want to just sort of, you know, use this session to discuss what are some of the things that perhaps, you know, editors are looking for so that you can, you know, put your foot forward, the best foot forward, and really, really at the end up with a high quality product that has a high rate of acceptance, okay? And my third citation is from one study in public health from 2017 with data from an online survey and telephone focus group. They find that close, you know, more than 2/3 of the time, the respondents say that lack of time is a challenge. Lack of encouragement and support from job, work, you know, supervisors, journal selection, technical writing skills, manuscript formatting, etc. So with that in mind, we're going to focus on a few things to overcome some of these barriers, okay? So here's my learning objectives for you guys. I want to make sure that by the end of this, you know, you guys will be able to discuss common barriers, which we discussed, describe how rigorous scholarship criteria are used during the process of manuscript review. And that's what I mean by the ins and outs. And then the third thing is to plan a systematic strategy for submitting manuscript to scientific or academic journals. So why publish? Again, some of you guys have said that, you know, writing is boring or writing is a tedious process, but I do want to let you know that publishing does accomplish many things, right? The ability for us to contribute to the field, right? What we call scholarship, for me is exciting because if I create new knowledge, if I apply new knowledge and other people adapt it and sort of learn from it and replicate it, that's exciting. Dissemination and impact, you want to make sure that you contribute to the field, right? Discoverability and networking. Again, once you publish something, once you've shared something, people know you, people recognize you, and it really opens up this possibility of networking with more people. Feedback through the peer review process, right? oftentimes, particularly in the beginning, if you submitted a journal, the reviewers oftentimes write really, detailed and hopefully helpful information or feedback for you, so that throughout the process, you can get better and better, okay? Career advancement is something that we may not want to talk about, but it's something very important. Publications do lead to promotion, do lead to, satisfaction and lead to recognition in your field. And then, we want to make sure that we don't duplicate work, understanding what other people have done, okay? So what do editors look for in a manuscript, right? You guys have sort of talked about that a little bit. So let me just show you a little more about what that is. So the initial, there are the peer review process. I shouldn't say the peer review process. The review process of a scientific journal, when you submit a manuscript, well, when an author submits a manuscript, that submission goes in a two-step process, okay? The two-step before a paper is even peer-reviewed, it goes through the first phase of initial screening, and that is done by the editorial team, which is a smaller team of people. At the Journal of Communication in Healthcare, we had 3 people. And so the first thing we look at is the fit or suitability with the aim and scope of the journal. So in other words, if in my, in the Journal of Communication in Healthcare, let's just say, right, someone could submit a paper, and I remember this, I guess a while ago, somebody submitted a paper about how the different healthcare systems operate in different countries, right? How is the system set up, etc. It's a fantastic paper in terms of describing the systematic or systems aspect of healthcare in different countries. However, it doesn't fit the scope, which is healthcare communication, right? And what happened was my response to that author was, thank you for your submission. Unfortunately, it doesn't fit our scope. However, based on what you submitted, I think if you narrow the scope in comparing the systems of communication, right, amongst physicians and patients, and or a communication within the hospital system, if you want to do that comparison, then it would fit into the aim of the scope. What I would also advise you guys is it is okay to write a cover letter or an email to an editor. And I used to receive that often. An author, a potential author, would write me a short email and just say, we are really interested in submitting to your journal. However, we're not sure whether it fits your scope or aim of the journal. Here is my, please see attached a copy of the abstract. So then I would look at it and I would say, does it fit? Does it not fit? And I would give very frank opinion. So please do not be shy about reaching out to the editor-in-chief and ask them that question. You can attach your abstract. The worst thing that can happen is they could say, sorry, it doesn't fit. Then you don't waste your time. You can go somewhere else, to search for that, okay? The technical checks is something that we do. What we call technical checks includes if the format fits, right? A scientific journal has intro, methodology, sometimes hypothesis, right? Methods, results, discussion. Some journals actually, accept more review type of articles. Certain journals look for more, randomized control trials and a lot of statistics, etc. And so things are a little different. So pay attention to that, the structure. The length is an issue for some people. Ethics really means like, have you gotten approval from your institution, the internal review board, the IRB, or the ethics review board? Conflict oftentimes arises. Author's information missing is an issue. Sometimes the manuscript is too short or not complete. That's an issue. Quality of English is also an issue. And later on, I have some resources for you guys to look at. and try to make sure that you are able to take advantage of those. Okay, so once it goes through that first stage, manuscripts that are submitted may be rejected right away. We don't review it. We say, sorry, we reject based on technical grounds. Okay, so that's the first thing to make sure that you satisfy. You're welcome again to contact us. The second step is this peer review or referee process, right? Oftentimes we require at least 2 reviewers during the initial round, and that's selected from a panel of reviewers. What happened is we want to make sure though that you understand that certain journals accept a list of quote unquote suggested reviewers. So you can go ahead after you submit to certain journals. In the submitting field, they would say, are there certain people you would suggest to be reviewers for your manuscript? And the criteria for that is as long as the people you suggested are not your friends, family member, right? And or the people who are co-authors that you have written papers with from previous submissions, then we would contact that person, okay? We try to make sure that, that the highlight in red, the criteria is rigor, innovation, contributes to the field. Something could be so new, so, the paper is great, methodology is great, results are great. But if it's not, if it doesn't have a huge impact to the field, then we don't necessarily accept it. And then the potential to be cited, right? Is the work important enough that other people will look here and cite cite this piece of work, okay? So, and certain journal also ask about this, and you guys should really pay attention and really think about this, right? What is already known about the topic? How is your piece new? How is your piece going to contribute to the literature? Okay. Then after that, then we decide. With that decision, I have another slide later to see what that decision means. Any questions so far from people, and any entries at all in chat? I don't see anything in chat right now, I guess. All right, we'll keep those comments and questions coming as we go along, okay? So somebody mentioned in Padlet, right, quality. And again, my comment was quality means many things to many people, but I want to break it down for you. So quality for me means rigor. Rigor means something meets a high standard. So what happened is Glassick, who is this researcher who was at the Carnegie Foundation, who basically undertook a study, and what Glassick et al. Did in 2000 is that they survey editors of journals, they survey the funders and foundations who give out money for research, etc. And they ask them, what are the criteria you use to accept proposals or to accept manuscripts? And there were many, many institutions who responded, and basically based on the data that they collect, they found out there are 6 areas, 6 domains that define good or quality scholarship. And then break it down to these. The first thing that you have to do is you have to state really clearly what your goals are, okay? I have read many submissions who go on and on for pages about some stuff, but I cannot understand why, the rationale or the why of what the author is doing. When it is not clear why, then as editors, we don't know how that is really contributing to the field, okay? The second thing is adequate preparation to make sure that the authors have done some work. And there's some detail of these slides later, so I'm just gonna highlight the areas now. The third one is appropriate methods, and I think we know a little more about what that means. Significant results. The results have to show something that's significant, something that we can apply, right? And then effective presentation has to do with the writing, had to do with organization of the paper. and all that. And lastly, reflective critique. And this really means whether the author have thought through some of those things about the work they've done, okay? So then a little more in detail, again, Glassex's criteria for assessing scholarship. And again, I think that these are the criteria that many conferences use, conference organizers use to judge the quality of submissions for a presentation. And they also use these to look at editors. We use these to look at the quality of submitted paper. So as far as clear goes, right, you have to state it really your purpose really clearly. You have to really define realistic and achievable objectives for them and identify important questions to the field. Why is it important, okay? The part of this about the adequate preparation is the authors must show an understanding of existing literature. So when you write a manuscript, and if the manuscript is repetition of something else that's been published, then it's nothing new. You're not really showing that, you know, something already exists and how you respond to it, okay? One of the things I have seen as a critique for rejected papers is that the author did not write in the introduction enough to address, you know, why they have not done enough literature review to understand what's already in publication within that field, okay? Bring necessary skills, right, to carry out the work. Who are the authors? You know, are they necessarily the people who have the skills? And then lastly, bring together necessary resources. I see a question in the chat. Is it okay to send an email to the editor before submit and ask whether the manuscript is suitable? Oh, absolutely. As I mentioned in an earlier slide, it is not just okay, we welcome it, right? If you do this and we say, look, you know, please go ahead and submit somewhere else because it doesn't fit, and or we can suggest an angle for you to change your manuscript, it benefits you, but it also benefits us because it doesn't waste our time or the reviewer's time, right? So appropriate methods is the next thing. So we want to make sure the authors use methods that are appropriate to the goals, right? If you're trying to study something, right, the quantitative numbers, mean, standard deviation, you know, confidence interval, if those things are important, then use those. However, sometimes the appropriate methods may be a qualitative study method, right? It's about words, about you know, survey with free text, about focus group, about interviews, etc. Right? So if that's more appropriate, then you know, that would be a win. If it's not appropriate, then we say no, it doesn't quite fit. If the authors apply the methods effectively and then modify approach as the circumstance requires. Okay. Significant results, I think, again, this is something that we all understand. We want to make sure the authors achieve the goal that they outline in the hypothesis or in the introduction, and they have to align, right? If the introduction says something, here's a gap in the literature, and then the results don't really, you know, respond to that gap or fill that gap or bridge that gap, then it's not really significant results, okay? The results have to contribute to the field consequentially, meaning that not just contribute, but the level of contribution has to be great enough, okay? And then also, does it open additional areas for exploration? Sometimes a paper may not answer all the questions, but if it brings up enough, you know, if it provides some answer, it opens doors to other studies that could be done subsequently, then that's also considered something important, okay? The next area is effective presentation. As I mentioned, it's about how do you write, how you talk, how do you disseminate. So use a suitable style and effective organization to prevent the work, right? The writing has to be the introduction, the methods or hypothesis, the results and conclusion fit together, fit into a cohesive piece, and they respond to each other in a way that flows. present at appropriate forum to intended audience. Again, this is about the journal, right? Is it the right journal that you're submitting to? And then present work with quality integrity. Again, that's about the writing, okay? Reflective critique has to do with the discussion section, right? Do the authors actually discuss limitations, have thought about what is successful about the work and what is missing, what has not addressed, and how does it open to your, the author's next stage, the next paper, the next project, and then bring appropriate breadth of the, into this breadth of evidence to evaluate your work, and then do the authors use evaluation to improve the quality for future work, okay? I hope that's clear to you guys, right? That these are the criteria of what we call quality, okay? Again, throw any chat in the, anything, questions or comments in the chat, okay? Nothing? Awesome then. The next part of this is what I am going to show for you is, my work with the group of directors of student education in pediatrics. We compiled 12 steps, and again, right, when in Padlet, many of you guys said no time, or too much work to do, or too many things, or too many steps. I want to just try to make sure that we go over some of these systematic way of making sure that things will work for you. And so with these, I'm going to go over the 12 steps that we as a group outline as recommendations for people writing papers. We started off with, if you present a poster, or if you do a presentation, right, an oral presentation or platform presentation, what happened is then we start from step one, but we often have feedback, right, from the poster session, feedback from the presentation. So once you do that, the next step, we think, even before you start writing, it's important to choose your team, okay? I often use this step as a step that I have to think carefully about what my strengths are and what my weaknesses are, and whether there are people who can fill those steps. I'm going to give you an example. I'm not very good at writing some of the methods section. So when I form a writing team or a team for research, I oftentimes would get somebody who is really good with number crunching, statistics, etc., to help me with the quantitative part. However, I'm very, very experienced in the qualitative analysis with interviews, with focus group and text and all those things, coding. Then I can have my strength there, okay? And then I know that some of my colleagues, they're very good with grammar, with editing, and they can make a 15-page paper down to 8 pages, which is what the journal requires. So I tend to do that with different people. However, I'm going to talk to you guys a little later about how do you even do that, right? Because sometimes how do you decide the people you want to be on your team deserve to be co-authors, and there are criteria for that as well, okay? The third thing is examine your topic, right? And be really honest to yourself. Again, what's the topic? How it's going to contribute to the field? And then it's going to help you from stage 3 to stage 4 is select a journal. And we're going to go over that. Develop an outline is important, right? An outline, oftentimes you can say in the introduction, right? There are 4 things I need to get out, or I need to really include these 4 things as an outline. Once that happens, the outline will help you do literature search, or I guess more literature search, because with your study, with your research, you already have done some of that literature search, right? But when you actually develop an outline, you can find more. And then once you develop an outline, it is easy then to assign to different groups, right? I will work on the introduction. Another colleague will work on the methodologies. Another colleague will work on the results, and then the whole group will work on the conclusion and all that stuff together. Okay. And then after that is review your methods, just to make sure that, again, everything is rigorous. And then you want to make sure that it's clearly stated. It's so clearly written that anybody else who wants to duplicate your studies can do that without any question. Then you critique the results, and again, making sure that when you do that, the results, is it better presented in paragraph format? What about tables? What about graphs? About all that stuff, okay? And then organize your references. I don't have things here, but at my institution, we use EndNote. EndNote is really, it's a paid service, but with my institution, it's an account with them, and I can use it. It is a reference manager where I could write something in Word document. I can import a lot of the references, and it automatically generates the numbers. And then I can also change it to different format so that you can say, oh yeah, if they want the Vancouver style versus academic medicine style versus some other style, then it's helpful to do that. It can convert automatically. Draft the introduction, draft the conclusion, make your point. Again, making sure that you are able to communicate your point. And lastly, review. Okay. I see that there are some questions in the chat. Okay. How to manage research funding proposal that's suitable for the funder? Being appropriate is kind state of art. What do we need? I have to say that funders oftentimes, write out their criteria really well. So when you look at review, or critique in some of these different steps, you want to make sure that these correspond or address or cover some of these funding, priorities. For instance, the Josiah Macy Foundation is a foundation that's for medical education. And what happened is they're quite clear. Their funding priorities are faculty development, interprofessional education, diversity, and cultural competency, right? And then there's one other that interprofessionalism, sort of like working together in interdisciplinary teams. So when you submit something to them, you have to make sure that everything that you write, everything you draft, everything that you submit as part of that has to address in some way some of these criteria. Okay. I feel discussion is the most difficult part in preparing the manuscript. What are the tips to be able to structure the discussion well? That's an excellent question. What happened with the discussion is that oftentimes the biggest mistake that people make, right? The biggest mistake people make is that their discussion just is a repetition of the results, right? They often say, oh, here's the result. And then the discussion, they say, well, we found this and we found this and we found this. The discussion section should be, if you go back here, right? The discussion section should be reflective critique. It's really to evaluate your work critically. And what it means is that you look at your work, your conclusions, your results and all that stuff. And you have to think yourself, am I or have I really articulate the gaps in the literature in the field I'm studying? And then in the discussion, talk about how your work, the results and all that stuff, how does it fit, not fit? How does it address that gap? How does it bridge that gap? Okay. And really not just repeat what your findings are, but really discussing what the previous literature has shown, how your work has a dialogue with those previous results and studies, and how you can actually advance further. So that's the first thing in the discussion. The second thing is, this second point I put here, right? Bring appropriate breadth of evidence to evaluate your work. Again, is to cite previous literature and just say, how does my work have a dialogue with that literature? And the third thing is use evaluation to improve the quality of future work, meaning that limitation, right? Thinking about, oh, with my next topic, how can I broaden it? How can I study a different aspect of it? Maybe, for instance, for this one, for your current study, you might be discussing, the efficiency of a certain practice, right, that you have implemented. And then in your discussion section, you might say this, that works in some ways, but the next one, or the things that you have not addressed, but is really an open field, is about the cost of implementation. I hope that makes sense to you. As a junior researcher, most work lands on one person, not really in a position to distribute the work with senior researchers. That's a really interesting thing. And so again, I will address that by this slide. Okay, I have this slide and there's something later. Choose your team, okay? Choosing your team is very important. And what I would say is that before you examine your topic, before you select a journal, before you do all that stuff, choosing your team, this step number 2, also involves discussing who are going to be the authors, who are going to be the lead author, and who are going to be the senior author. So oftentimes, right, when you think about promotion and really advancing in the field, many fields would say, you have to be first author on certain papers to count, or you can be the second author on a paper to count, or you could be the senior author, which is the author on a string, a number of them, maybe 5 or something, and you're the last author. That also counts because you're the senior author supervising everybody else, right? The navigation is that you have to be really, really upfront about it, and you have to discuss it from the very beginning. Years and years and years ago, I was collaborating with somebody, and we did not make that really clear. And you know what happened? That person, when we had that discussion later on, she started crying and she said, I'm sorry, I really, really need this paper. So can I be first author? And we discussed about this. And at the end, she did not really qualify to be first author because of that reason. Okay, so I have another slide that I'm gonna, or not another, what do you call it, resource for you guys. And I'm gonna go there in a minute, okay? Somebody said, what kind of scholarship are available for publication? Is it possible to get a full scholarship for OA journal or open access journal? I only know about a discount or waiver for some countries, namely local. Got it. So something that is an open access, I'm not covering very much about open access. Open access is something entirely different. So at Journal Communication in Healthcare, we have the open access option and the non-open access option. So the author can do both, okay? Traditionally, journals that are not open access usually are considered higher impact. Open access journals tend to have lower impact, and the field still does not recognize open access journal as much. However, things are changing, and that may be changing for the better, because the more you share, the more people are able to advance scholarship. Okay, so I'm not talking too much about the open access journal, but just to let you guys know that, again, once we get to that, where to submit and how to select a journal, you will see there's so tons of them they can choose from, and hopefully that will be helpful to you. Okay, in your slide, writing introduction is put after writing results. Would you explain why? Okay. What happened is the introduction, what we find is that once you write the introduction, you often find that, I'm sorry, hang on one second. Let me just make sure I understand your question. Writing introduction is put after writing the results and discussion. Would you explain why? So what happened is I have a lot. So the writing part, right, is the process of writing. But I think that many of the introduction has already been formed in your head or within your discussion, right? So when you are embarking on a research project, yeah, oftentimes you make sure that you understand the gaps in literature and what you're trying to see, okay? The reason we find that writing the introduction later on after that is because when you look at your methods again, when you look at your results again, sometimes in your head, when you look in a lot of these back and forth, you might realize, oh, there is something else you haven't really addressed. There's some other pieces of literature that you may need to really bring back and address. And once you do that, you may realize, oh, we're not really addressing that piece of literature. And therefore, we may need to narrow our focus. And then in the limitation section, in the result section, I'm sorry, not result, in the conclusion section, you would really be, having the conclusion respond to the introduction. So we think of the introduction and the conclusion as a dialogue with each other, okay? And then let me see. Reference journal. I heard that using some journals from the targeted journal to submit the best option. For me, I think what to cite and what to reference have to be first and foremost appropriate. Okay, it does not have to be from the particular journal and particular publisher. It doesn't in the long run help you as much, because oftentimes when reviewers look at submissions, they often look at not just where the articles are coming from, but they would scan through that citation, just say, "Ooh, does it fit? Does it not fit?" And if it doesn't fit, even if from the journal, it really doesn't make sense. The last question, and I'm going to do this last question and then move on because I'm also looking at time. Okay. Some says that qualitative study is hard to get accepted into scientific journals. What is your comment? Well, that fortunately is really changing. It really is changing, because what happened is in the past, there's not really, a really rigorous way of doing, the data analysis. But now more and more journals are accepting qualitative research. And I'll give you an example. When I started my editorship a few years ago at the Journal Communication in Healthcare, we did not have too many reviewers who are qualitative reviewers, right? But then when we had a lot of submissions that use qualitative methodology, I needed more people who are familiar with that process to be on my panel peer review. So I recruited more people. So I realized that that's a need. And I think many other editors from many other journals also think that is a need, and therefore they are recruiting more people. Now, I think I referred to you to this point before. It may not be that qualitative studies do not get accepted to scientific journals. It oftentimes is that the qualitative studies are not done well. The data collection or analysis have not been done well, or the methods are not appropriate, and that may contribute to why qualitative studies do not get accepted. Okay, we're going to move on a little bit in the interest of time. So this is the slide I was mentioning, right? Before you begin writing, when you choose a team, right? Talk about authorship, how important it is at your institution and field. Like for instance, right? Like for me, I'm really close to being promoted to a professorship, and therefore it doesn't matter to me as much to be first author. So I often, when we are in a team, I would delegate to the more junior person, just say, I think you need this in order to advance. And so many times you guys should really, network and look for some of those collaborators, or what we call mentors. And once you have the mentors, right? Mentors should be the one who really help advance your field. And so that will be really important. So now I'm going to click on this, right? When you guys look at this, look at this is the Elsevier where they had fact sheet for authorship. They really went over what it means to be an author, right? Like for instance, the order of authorship should be a joint decision with the co-authors. Individuals who are involved in the study but don't satisfy the journal criteria for authorship should be listed as contribution or acknowledged, right? For instance, you may have an assistant who is helping you with the research, but they're not really doing any type of analysis. They're not writing, you know, a big chunk of the paper. They should not be co-authors. Or another one that I have encountered more frequently is that, you know, we would take our paper and we would send it to, you know, a colleague to look at for grammar, to edit down the length or whatever. Those colleagues get acknowledgement. They do not become authors. They don't become co-authors, right? So this is something that would be helpful for you guys. And by the way, do you remember again how I had links in the chat? The links, the last link, not the last, yeah, the last link is resource sheet on Google Docs. When you go there, the links for this criteria for authorship and all those things are in that link. I want to make sure you guys have access to that, so that, you know, even after this session, you can go and look at what the resources I show with you. Okay. The next step, examine your topic, is again article type, you know, target audience, right, and select a journal. So selecting a journal. Here's some detail, right? Does it fit? Is it suitable? You talk about the audience, right? In addition to the aim and scope. For instance, there are some journals in public health. It's about the practice of public health, but there's some journals about the education of public health, which really is looking, you know, the audience is more educators and teachers, and they really want to make sure that, you know, there's curriculum and there's some other things related to education in it. So that's taking into account the audience in addition to the journal, right? Really review the journal's website to check out the author instructions. Impact and prestige is really important. Sometimes for some people, they really want to submit to high impact journals because that's what really going to help them in their career. There's some indexing things, and you guys have seen some of those, right? Impact factor, some of those things, and they may be indexed in the Web of Science, PubMed, and other places, okay? Opportunity cost, what I mean by that is, if you submit your paper to one journal, and that journal is so high, so prestigious, right? You submit there, you're losing 3 months, you're losing 4 months, because the process of reviewing, while that's going on, you know, the agreement is that you will not submit your paper anywhere else, right? So you sort of have to look for the golden mean of a journal that is high impact, but not so high impact that you have a much lower chance of being accepted, okay? That's what I mean by opportunity cost. And then there are others, we talked about this, and again, we're not gonna cover that. Next one is, you know, these are some of the reasons people choose to publish, right? Has a relationship I want to reach, overall prestige, journal and publication venue that fits into your field or your peers regularly read, journal that I regularly read or you regularly read, impact factor, and you can see sort of the rest, okay? The resources, this is an important slide. It is so important that I'm gonna give you an example, okay? So I see something in the chat. In discussion, right? In discussion writing or writing the discussion, we compare the results of the study with similar previous studies, whether the results are consistent or not. What about research with a new theme and no similar research before? Then you should say that. You don't have to compare necessarily. You compare when there is the, you know, result available. When it's not compare, you can actually just toot your horn and really say, look, nothing has existed before this. That is how important my research is. And then go on to say, it's something so incredibly new and it will really open the, the door for other researchers or for my own work in the future. So that's what I would say. So again, this is so important that I want to go ahead and do this for you guys, okay? So I have on my screen here, right? This is an article that we published in the journal Communication in Healthcare. This was not under my tenure, it was under the current editor's tenure. This is after I had stepped down. And this is a paper that says individualizing mental health responsibilities on Sina Weibo, which is a social media in China. And they're really looking at content analysis of depression framing by media organizations and mental health institutions, right? And then here is, I have the abstract here at the bottom. And then, these are by these 4 authors in China. Now, I'm gonna copy and paste, okay? I copy and paste this, you see this, right? And what happened is, these are the 4 resources that are also in that resource sheet that you guys should have access to. The first one I love, the second one I really like a lot, the third and the fourth one are also helpful. So this one is called Jane, and you just refer to it by Jane. It's journal or author name estimator. If I click on Jane, right, it goes to here, welcome to Jane, right? Insert the title of abstract. Look what I did. I basically copy and paste the abstract, and you can do that with your own paper. Copy and paste your own abstract into the field of Jane, and you say right here, find journals, okay? Watch the magic happen, okay? It actually shows you the confidence of it matching on the left-hand side, right? And then it says, it suggests all these journals, right? It also tells you that the Medline index, high quality open access, etc. So isn't that a really, really great resource? Okay, please try to use this. The second thing is Elsevier, and Elsevier does the same thing, right? It basically goes here and say, and enter your paper title here, or your abstract here, etc. And then you say find journal, right? So, but the thing about Elsevier is that what it does is it doesn't look for journal elsewhere. It looks for journal under the Elsevier family, right? It sort of gives you a little bit of information, and look, it even tells you time to publication, etc., time to decision, right? So these are really helpful, right? I won't go on to illustrate these 2 other ones, but I want to make sure that you understand that there are resources to help you with that, okay? I pretty much illustrated that already. Okay. I see a chat comment. It says, with regard to impact factor, the higher the better. Someone once told me that 1 to 2 is good, 2 is better. I found many questions, 1 to the impact factor. So here's what happens. Impact factor also depends on the field, okay? If you have, a journal like Nature, right? A journal like New England Journal of Medicine, a journal like the Journal of the American Medical Association, those things will have impact factor of like 4, 5, 6 higher, right? However, I work a lot in medical education, and a lot of my work is in medical education. Within medical education, anything over a 1.5 is considered very, very rigorous, right? So you kind of have to know in public health or in your field what some of those criteria are, okay? So these are similar things, and again, I have these on the resources. So like for instance, we go to Taylor and Francis, and again, Taylor and Francis is the publisher for us, the journal Communication in Healthcare, right? It goes here and just say, oh yeah, author services, writing your paper, preparing you and writing an effective research paper, right? It tells you know who you're writing for. It tells you some of these things. Read the guidelines. It gives you, sort of certain things, and it has like tables and figures and things for you to look at, right? I have to tell you that a lot of these, right, they're a little more conventional or traditional. So they say, prepare the table and figure first and write up literature review, which is the intro, methods, etc. So the order is different from ours. Again, that was in our experience, that was important. But you see this too, prepare table, figure, literature review, whatever. Look, they say write the introduction towards the end, okay? And the abstract even comes after, because you kind of have to understand all those big things and write an abstract that's really compelling. So it's really kind of consistent with what we do. Okay. Similar thing, Elsevier has its own thing. You know, some other also have their own thing. I do want to show you one other thing. Oh, here, for this Lippincott, right? They don't just have particular, you know, descriptions and stuff. Look, they have webinars, right? It's a video. You can go and basically look at that. How exciting and how useful is that, right? I want to show you one other resource. And this is the participant resource I was talking to you about, right? The resource sheet. On bottom here, Himmelfarb Health Science Library. It is at George Washington University. Look, it shows you kind of step by step. It has some descriptions. It has introduction to scholarly publishing, right? It has YouTube videos embedded. It has journal selection tools. And look, eDance is it's number 3 that I put on my journal selection or searcher slide, right? And then intro to predatory publishing. And again, you guys should check on these, because these are the things that I don't, you know, cover at this point. And this is, again, you know, altmetrics and other things. It's about impact factors and all that stuff. Okay. So questions or anything before moving on? Awesome. So a few more helpful tips, right? Cover letter. It's not required, but if it is required, make sure that it's succinct, compelling if you send one. For instance, a cover letter should not be more than 1 page. A cover letter should really not be a repetition of your abstract. A cover letter should really tell the editor, look, what is my research about? Really short couple of sentences. It should really convince me and other editors to say, my research is important because it's filling the gaps and the need of the field, okay? It has to be to the point, really well written, and short, because if it's longer than 2 paragraphs, I might not read it, or I might just say, oh, this, you know, this author goes on and on, okay? The second thing is the keywords, right? The keywords should help the readers locate your work, right? And it should be related, I should say, to the manuscript content. And it should spell out any acronyms. So in other words, you shouldn't just, you know, write like ACS, SAMA, or something like that. Suggested reviewers we talked about already, right? In this box, suggested reviewers, right? Some journal assets, and then format-free reference style. And what I mean by that is Francis and Taylor now started to not require authors to limit themselves to a particular reference style, right? For a long time, many journals require Vancouver style, and then some other journal require this style. At this point, our journal and many other Taylor and Francis published journals, we say, you don't have to fulfill the exact reference style that the journal is asking for, as long as it's consistent. As long as all the citations you have is consistent in one style, the editorial team and the support desk will be able to help you, you know, change and modify some of those, okay? One other thing I want to show you guys is I really have not been very good with mesh headings or mesh terms. Mesh here stands for medical subject heading. And these are the things that librarians love. And these are the things that librarians use to locate particular subject, etc. If you go ahead and use the right key words, use the right mesh terms, it means that people would discover your manuscript much more easily, much more rapidly, and that helps you in the long run, right? So I want to show you this. It's a mesh heading. Again, it's not really, because I'm really bad at it, right? I try to find resources that help me. So then you can basically copy all your, you copy all your different things or whatever, and basically, or your title or whatever, and then you can search for what the mesh terms are, and that's really helpful. Okay, so we move on. There's a few other things to keep in mind, right? And you can see many of these words up here is about grammar, it's about writing, about all that stuff, whatever. And so there are spell checks and grammar services that you can have. Microsoft Word tools have spell checks and thesaurus where you can find, different words for the same or similar meaning. Grammarly, and again, I don't have any financial interest or whatever, but I use Grammarly because English is actually my third language. And so I don't really, sometimes I make those mistakes grammar-wise. So I basically pay, 99 cents a month, and it basically gives me the ability to use an online thing to check my grammar, check my writing, etc. And I can also set the parameters so that I can, if I have Grammarly as a service to help me check my grammar and stuff like that, I can select and make sure that it is filtered so that this piece of writing is formal, is informal, is to present, to explain, to convince, right? And so all those things could be checked and filter. And so the program would then, use different algorithm to help me with my writing, the sentence and all that stuff, and the clarity and all those things, okay? Quality of English, I just want to say that there are editing services. Taylor & Francis has our own editing services. There's some commercial ones that are usually count by the number of words, etc. So consider those. I don't have any particular access or recommendation about those. Copyright, there is Elsevier cross-check. And Elsevier cross-check, if you go there, you can actually say, they can show you, are there some things that have been published before? Are there sentences and stuff like that you shouldn't be using because that's really plagiarism. That's really a duplication of other people's work. So I would just check out their service called Elsevier cross-check. Ethics approval, really important. We discussed that before. And then solicit feedback. You should ask for feedback from colleagues and mentors, and just to see whether they have anything else. And sometimes it's really good to ask somebody who is a lay person, who is not a scientist, who is not in academics to read your work, so they can really provide you with honest third-person feedback, okay? Here's some common reason for rejection, and I think, we talk about the two-step process and stuff, right? So the first two bullets in black are about the technical check. So ignoring journal format, the structure, the length, etc. And then poor fit, right? Is it not a good fit for the journal? And again, what's in blue is really what we think about the rigor or the level of scholarship. And that includes a lack of originality, missing rationale, the flaws in the method, poor writing, quality of English, grandiose conclusion. I see that actually a lot. You guys may not think that this happens a lot, but oftentimes, people may say, oh, they write the introduction, they have the paper, the methodology, and then they get pretty good results. And then at the end they say, while my research applies to XYZ and talk about it really grandiose terms. And when it's grandiose like that, it means that there's a huge disconnect between what you're trying to conclude and what the paper actually, has results to show, right? So that is a common thing for rejection. Missing literature review and citation is also a good reason for rejection. Again, go back to Glass's criteria and think about these six steps and six domains. Okay. So once you get accepted, congratulations, fantastic. Your work is not quite done. The big part is done, but it's not all that done. If you get a rejection, you oftentimes have, the comment section, and take that with appreciation and grace, because the reviewers and the editors are not there to get you. We're not there to make your life miserable. We're there to help you so that you can address some comments and maybe change certain things, or maybe based on the comment we submit to another journal, right? Review the author instructions and really make sure that you address them one by one. And then the group decision is discussed with your authors, right? To make sure that, do they really, what do they want to do? And then if you get revisions, or, the editor said, it's a good paper, there's a missing piece, missing link, or whatever. There's some, the examples of these revisions could be major writing, and major writing is a big thing, right? It means that you have to rewrite 50 to 75% of the paper because there's flaws in the methodology, or methodology is not clear. You have to make sure that you explain it more clearly. The conclusion, the support, so you have to do a lot of that. Major revision means that the structure of the paper is there. There are some things that you need to change, sections you need to move, and all that stuff. Minor revision is a pretty good, decision. It means there might be grammar. It may be some of the, the one or two sections or one or two paragraphs that need to clarify, etc. Okay. Again, be appreciative, be grateful, and be gracious in accepting those, right? Pay attention to instructions, respond point by point, handle disagreement with reviewers' comments thoughtfully. Because sometimes you might say, well, I don't really agree with the reviewer, but then you're gonna have to explain that in a very calm, logical, and really patient manner, because disagreeing in a strong emotional way will not help you in the long run. You may ask editor for help, clarifying and guidance. I've gotten a few of those, and if I can help them, I usually say, sure, what the reviewers mean X, Y, Z, and I would suggest you do X, Y, Z. But that usually takes a little longer. Okay. After you publish, you may want to promote your work after promotion, right? Taylor and Francis has, their ways of 5 ways to maximize the reach of your work towards the audience. Elsevier has their own stuff. And then think about citations and attention, because it's really being indexed or cited in somewhere else. And then many journals, including ours, have LinkedIn accounts, have Twitter accounts, and many other social media platforms to promote, okay? So in summary, we want to make sure that, we familiarize yourself with the process of the manuscript submission process and the review process, adherence to author instructions, make sure that the Glass's criteria is adhered to. The 12-step roadmap may be helpful for you. And then remember that very few scholars get published after their first submission. So a rejection in the beginning does not necessarily predict a poor career outcome. And I can tell you that because I've seen many examples. Now, I would like for you guys now, then, this is my last slide before my thank you slide, but I want to make sure that you guys use the last few minutes to engage again. One is commitment to change, right? The same Padlet will ask you that question. What are your take-home lessons from this session? What are you committed to doing in the next 6 months? And then you can use the QR code on the left-hand side, or the Padlet link in the chat. And the second thing is your feedback. And the feedback I will not be showing. This is just anonymous for me to look at later. is you can use
Jadi, iya,
oh,
kita ketemu deh.
hang on. I gotta, okay, good. So you can use a QR code or the link, okay? And then I'm going to just come here and show it. Again, please go ahead and populate these questions for everyone to see, okay? Otherwise, that's all I have to say. And I just wanted to see if anybody has any comments to put in chat. Anybody has anything to share? Oh, what did I just do? Sorry. Anybody has anything to share on Padlet? I would really appreciate it. Am I losing people? Thank you, thank you. So please keep the comments coming. And if someone feel compelled to unmute themselves and ask a question, please go ahead as well. Okay. So coming here, right, I see that now I know I can send email to the editor, great. How to prepare for journal publication, great. Anything else, any particular things? It's selfish, right? Like a lot of these answers I want for myself because I want to make sure that after this session, it's not just me, talking. I want to make sure that, you guys are actually getting the gist and taking something away from this session. And I guess at this point, you can also feel free to unmute yourself to talk. Anybody else?
If anyone would like to ask a question, you can just unmute yourself and raise the question. If you want to give a comment or anything, you can just unmute yourself and go ahead.
Okay. And then also, comments for organizers. Do you guys have anything else to add? Great. Commit. Great. I'm so happy to hear that. Okay. Excellent. I love this one because, again, so very few people are successful the first time they try, right? Excellent. I'm glad that those resources are helpful to you because they are so immensely helpful to me. Yep. And again, right, thinking back, many of you guys said, right, writing is boring, writing is tedious, etc. But it does lead to something, and there are different ways of doing that. Okay. And then if you guys don't mind, sort of adding onto this would be great too. Excellent. Step by step, excellent. Yep, awesome. I'm sorry if the survey QR code is not working. Do you guys have the links then? Let me just make sure I have the links to this, okay? Ooh, sorry, hang on 1 second. Can someone help me with posting the link?
Yes, I did. I already did.
Great, thank you so much. Thank you. So please go ahead. And then again, if you're not responding to this, please respond to the anonymous feedback link because I would love to hear from people how I can improve this session and what other resources I can, really add, right? So start writing, please. I would say start writing, but also assembling that team, right? Think about the people who have strengths that you don't have or can complement each other. Very, very important. Rewriting, excellent. This is great. And please keep in mind to respond to the reviewers point by point in a great journal. Please use those journal selectors and finders. That's really helpful. Great. Love. I love Jane. Love, love, love. Perfect. Outline, start writing, keep on doing research writing. Fantastic. And again, right, like it's so once you use Scholastic's criteria, once you start writing, once you discover the joy of some of these things or whatever, it just keeps going. Okay. Thank you so much, everybody. I will stop sharing now, and hopefully everybody is really has what you call it has responded to my anonymous survey. Okay. Any last comments or words from the organizers before we log off?
We have still 5 minutes left, so we can give it to the audience. So if the audience, if you have any last minute questions or comments or anything that you would like to ask Dr. TJ, you have 5 minutes left, so you can unmute yourself and directly talk to Dr. TJ, or else you can put them in the chat box as well. So if you have anything, it's over to you. Thank you.
No? Well, then I hope this session has been very helpful to everybody. Okay.
All right, perfect. I think that's all we have. So thank you so very much, Dr. TJ, again for this wonderful and very insightful workshop that you gave. I can see that there are so many comments are coming in the link that you sent. So it's really helpful for all the researchers who are here. So thank you so very much on behalf of the participants. I would like to thank, and on behalf of the committee also, I would like to thank for delivering this very interesting and insightful workshop, Dr. TJ.
Thank you so much. Great meeting everybody. Good luck with your career. Take care.
Thanks a lot, Dr. TJ. Thank you.